Chances are you've been hearing an awful lot about the hantavirus outbreak in this cruise ship at the center of it all. It's about to dock in the Canary Islands, so passengers suspected of being sick can get into isolation. A team from the CDC will be there off the coast of Africa, helping 17 Americans get to a specialized facility. So far, 3 people have died, and now it's getting closer to our state, with officials in New Jersey monitoring 2 possible exposures tonight. For a lot of people, it's bringing back some painful thoughts, painful memories of the COVID-19 pandemic. We don't even want to go there. But that's exactly why we want to help you understand tonight how hantavirus is different and why health officials stress there's a low risk of it spreading. Here's NBC Connecticut's Stephen Pappas.
For some, the thought of not again hearing about the potential spread of an infectious disease. But what is hantavirus and how easily does it spread? I'm certainly no expert, so we talked to someone who is.
It is transmitted by rodents. So usually the way that people will get it is when you are cleaning up something, you get exposed to airborne urine or droppings from rodents.
It's important to remember that hantavirus is not new. According to the CDC, 890 cases of it have been treated in the U.S. since December 2020. Experts, though, say this strand is different, but not something that should cause you to worry too much.
What's unusual about the Andes virus is that there has been reports, cases of person-to-person transmission, so that will not be through the rodent reservoir.
And the incubation period for the disease is a long one, up to 3 weeks. And doctors say that some of the early symptoms are a lot like the flu: diarrhea, vomiting, muscle aches and pains, and fevers.
And when it gets into the lungs, it causes what they call acute pulmonary distress. So it causes severe lung impairment, and that can result in death very rapidly.
But hantavirus does not spread the same as COVID or even the flu. It takes prolonged exposure to the disease in enclosed spaces. And if you're worried about it turning into another version of COVID, most experts say don't be.
I think that the public, again, should keep that in mind, that they are most likely, very safe, and that the potential for, a pandemic or anything, remotely close to a pandemic at this moment and for the near future is very low, unless something really different happens.
Something the Connecticut Department of Public Health agrees with, saying that the risk to the public is low. Right now, they don't believe any passengers on that cruise ship are from our state, but they are working with the CDC. Stephen Pappas, NBC Connecticut News.